Namaskar. Welcome to my YouTube channel. Today we are going to discuss about RRB Paramedical Nursing Superintendent 29th April 2025 second shift question answer part 1. Let's start. The first question: the primary test to identify Pseudomonas aeruginosa in the laboratory is dash. Option A, catalyst test. Option B, nitrate reduction test. Option C, oxidase test positive. Option D, coagulase test. The correct option is option C, oxidase test positive. What is the mechanism of action of amiodarone? Option A, beta adrenergic receptor blocker. Option B, sodium channel blocker. Option C, calcium channel blocker. Option D, class 3 antiarrhythmic drug. The correct option is option D, class 3 antiarrhythmic drug. Which of the following is a potential complication of frequent nebulization therapy in pediatric patients? Option A, tremors and tachycardia. Option B, decreased respiratory rate. Option C, increased blood pressure. Option D, decreased heart rate. The correct option is option A, tremor and tachycardia. The two-factor theory of intelligence was published by option A, Louis L. Thurstone. Option B, Garcet. Option C, Charles Spearman. Option D, Edward. The correct option is option C, Charles Spearman. What is the most common initial sign of renal tumor? Option A, mass in the flank. Option B, painless hematuria. Option C, flank pain. Option D, colicky pain. The correct option is option B, painless hematuria. Which statement best explains the urinary retention? Option A, inability of the bladder to empty properly. Option B, infection of the urinary tract. Option C, excessive urination. Option D, inability of the kidneys to produce urine. The correct option is option A, inability of the bladder to empty properly. A good nutrition helps in maintaining dash. Option A, only physical health. Option B, both physical and mental health. Option C, only mental health. Option D, only body weight. The correct option is option B, both physical and mental health. While performing CPR in a patient who had cardiac arrest, to maintain the quality and rate of compressions, rescuers should change role in every dash. Option A, 4 minutes. Option B, 3 minutes. Option C, 2 minutes. Option D, 1 minute. The correct option is option C, 2 minutes. Which of the following component is transferred from mother to fetus through placenta? Option A, red blood cells. Option B, white blood cells. Option C, platelets. Option D, immunoglobulin G, IgG. The correct option is option D, immunoglobulin G, IgG. Which vitamin supplement is most important for pregnant women to prevent neural tube defects in fetus? Option A, vitamin B9 folic acid. Option B, vitamin A. Option C, vitamin C. Option D, vitamin E. The correct option is option A, vitamin B9 folic acid. Which hormone secreted from pituitary gland that stimulates ovary to secrete estrogen in adolescence period? Option A, adrenocorticotropic hormone. Option B, growth hormone. Option C, prolactin. Option D, luteinizing hormone. The correct option is option D, luteinizing hormone. Which drug is used for the treatment of anemia associated with renal failure? Option A, ferrous sulfate. Option B, interleukin. Option C, iron dextran. Option D. Erythropoietin. The correct option is option D. Erythropoietin. Which of the following is a fundamental rights of an Indian citizen? Option A. Right for equal pay. Option B. Right to an identity. Option C. Right to freedom. Option D. Right against being stalked. The correct option is option C. Right to freedom. When a person's blood pressure rises, the hemostasis mechanism to compensate for an elevation involves stimulation of option A. Chemoreceptors that stimulate the sympathetic nervous system, causing an increased heart rate. Option B. Baroreceptors that innervate the sympathetic nervous system, causing vasodilation. Option C. Chemoreceptors that innervate the sympathetic nervous system, causing vasodilation. Option D. Baroreceptors that innervate the parasympathetic nervous system, causing vasodilation. The correct option is option B. Baroreceptors that innervate the sympathetic nervous system, causing vasodilation. In TNM classification system, ascending degrees of increase in tumor size and involvement is denoted by dash. Option A. Ts. Option B. T1 to 4. Option C. Tx. Option D. T0. The correct option is option B. T1 to 4. Which assessment tool is commonly used to document family genetic history? Option A. Growth percentile chart. Option B. Pedigree chart. Option C. Developmental milestone chart. Option D. Medical record review. The correct option is option B. Pedigree chart. The brain tumor located in adduct of synovial causes hydrocephalus by option A. Reducing CSF drainage. Option B. Obstructing the flow of CSF circulation. Option C. Decreasing the absorption of CSF. Option D. Decreasing the production of CSF. The correct option is option B. Obstruction the flow of CSF circulation. Individual with dash blood group is associated with a high risk of developing gastric carcinoma. Option A. Type B. Option B. Type AB. Option C. Type O. Option D. Type A. The correct option is option D. Type A. Which first-line medication is commonly used during labor induction for intrauterine fetal death? Option A. Magnesium sulfate. Option B. Misoprostol and prostaglandin. Option C. Terbutaline. Option D. Oxytocin only. The correct option is option B. Misoprostol and prostaglandin. The first issue of Worldviews on Evidence-Based Nursing Journal was published in the year option A. 2006, option B. 2004, option C. 2000, option D. 2002. The correct option is option B. 2004. In Rh hemolytic disease, when does maternal sensitization typically occur? Option A. During delivery of the first Rh positive infant. Option B. During the first trimester of the first pregnancy. Option C. During the third trimester of the first pregnancy. Option D. During the second trimester of the first pregnancy. The correct option is option B. During the first trimester of the first pregnancy. The cell which is primarily responsible for immunity to intracellular virus, tumor cells and fungi is dash. Option A. C. Cytotoxin cells. Option B. Natural killer cells. Option C. B. Lymphocytes. Option D. T. Lymphocytes. The correct option is option D. T. Lymphocytes. The following disease has greater risk of developing hyperkalemia. Option A. Renal failure. Option B. Diarrhea. Option C. Head injury. Option D. Dementia. The correct option is option A. Renal failure. Baroreceptors are sensitive to changes in dash. Option A, oxygen saturation. Option B, blood value. Option C, blood pH. Option D, arterial blood pressure. The correct option is option D, arterial blood pressure. Which layer controls motility of the digestive tract? Option A, lamina propria layer. Option B, submucosal layer. Option C, muscle layer. Option D, serosal layer. The correct option is option C, muscle layer. Which immunoglobulin crosses placenta and protect the newborn naturally against bacteria? Option A, IgG. Option B, IgD. Option C, IgM. Option D, IgA. The correct option is option A, IgG. Mental hygiene primarily refers to option A, the cleanliness of mental health facilities. Option B, the practice and study of maintaining and promoting mental health. Option C, personal hygiene habits during psychiatric treatment. Option D, the treatment of diagnosed mental disorders. The correct option is option B, the practice and study of maintaining and promoting mental health. A woman who is in labor pain in the case for water refers to dash. Option A, fluid trapped between the presenting part and membranes. Option B, fast urine passed during labor. Option C, amniotic fluid that leaks before true labor begins. Option D, fluid from the cervical glands. The correct option is option A, fluid trapped between the presenting part and membranes. Which psychophysiological measure can supplement traditional psychometric assessment of emotion perception? Option A, body mass index. Option B, blood pressure monitoring. Option C, galvanic skin response GSR. Option D, reflexes testing. The correct option is option C, galvanic skin response GSR. Humoral immunity is regulated by option A, cytokines. Option B, B lymphocytes. Option C, T lymphocytes. Option D, antigen presenting cells. The correct option is option B, B lymphocytes. The symptom of elephantiasis chronic obstructive lesions is seen after dash years from the onset of the first acute attack. Option A, 1 to 5. Option B, 15 to 20. Option C, 5 to 10. Option D, 10 to 15. The correct option is option D, 10 to 15. A patient complains of severe chest pain not relieved by rest, position change or nitrate administration. These symptoms indicate patient is suffering from dash. Option A, stable angina. Option B, unstable angina. Option C, nocturnal angina. Option D, myocardial infarction. The correct option is option D, myocardial infarction. Which of the following is not a recognized risk factor for the development of renal carcinoma? Option A, hypertension. Option B, smoking. Option C, hemodialysis. Option D, obesity. The correct option is option C, hemodialysis. Which of the following fetal or neonatal complication is associated with hypertension disorder during pregnancy? Option A, intrauterine growth restriction. Option B, hypercalcemia. Option C, macrosomia. Option D, delayed lung maturation. The correct option is option A, intrauterine growth restriction. Which determinants of health believes that if the environment is favorable to the individual, he can make full use of his physical and mental capabilities? Option A, health services. Option B, biological. Option C, socio-cultural conditions. Option D, environment. The correct option is option D, environment. Thank you for watching. Please like and subscribe.